Hello everyone, a very good evening to all of you. Today I am Dr. Mansi from Homeopathy 360. I welcome our today's respected sir, Dr. Vikas Singhal. So first of all, sir, it's our privilege to have you on this platform today, and we are going to learn on the very interesting topic today. But first, I would like to introduce Dr. Vikas Singhal. Dr. Vikas is one of the India's leading homeopathic physicians with nearly 2 decades of clinical experience. Since 2004, he has been practicing at Dr. Singhal Homeo, Chandigarh, treating patients from India and across the globe. Known for his research-driven approach, Dr. Singhal has played a key role in redefining classical homeopathy through his work on the molecular mechanism of action of homeopathic medicines. A strong advocate of holistic healing, he integrates nutrition with homeopathic treatment and is deeply committed to patient welfare. Through his educational initiative, he has his YouTube channel Homeo Doctor, and participation is national and international conference. Now, I would like to mention some international publications of Dr. Vikas Singhal. So the very first in International Journal of Homeopathic Science 2025, Dr. Vikas Singhal has written on observational case study homeopathic treatment for warts anal with secondary syphilis and anal fissures. Dr. Vikas Singhal is also invited as royal speaker at the third International Ayush Conference and exhibition in 2026. So, sir has published various research papers on the national and international. We are very inspired from you, sir. He is also known for transforming the perception of homeopathy from an alternative therapy to a vital component of public healthcare through a patient-centric and research-driven approach. Successfully treated complex and chronic conditions such as rheumatoid arthritis, ulcerative colitis, vitiligo, and whatnot. And today we have Sir on the Homeopathy 360 on the very interesting topic on osteomyelitis. So, sir, we welcome you all. And now I would like to hand over the mic to you.
Okay. Am I audible to everyone? You can type yes in the chat box. And the mobility returned. And by April 2025, he achieved complete clinical and radiological recovery with no relapse, 1 year of follow-up after the treatment. This case itself suggests a potential role for individualized homeopathy in chronic osteomyelitis, encouraging the integration of complementary and conventional care along with other system of medicine, along with the conservative system of medicine, I should say. So this case is already presented in 2 conferences, and this is a classical case. Although we have myriads of cases now, we have number of cases for osteomyelitis being in pipeline. Patients are improving very well. Patients are healing. So right from introduction part of the osteomyelitis, as you all are doctors, you know this very well, chronic osteomyelitis, what exactly this can be. But for the students, for the newcomers or new joinees or new attendees, I am going to repeat this. This osteomyelitis is a severe inflammatory bone condition. Don't take it so lightly and don't try to take up the case without the help of some senior doctor. This is an advice for the juniors also. This case is very having very deep pathology, so one should not intervene until and unless he or she has got some mastery in that. So it may occur acutely or become chronic, often involving the long bones like the femur or tibia. Chronic osteomyelitis leads to necrosis, sinus tracts, sequestra, and functional impairment. Conventional treatment relies on the long-term antibiotics and surgery, but often with limited long-term results. So this case report presents a boy with chronic osteomyelitis of left femur, non-healing pus discharge, and risk of immobility. Besides giving hope and presenting the evidence of effectiveness of homeopathy, this present case also raises the question of why an integrative approach is not accepted when it comes to treating conditions deemed incurable. So this is my question to the system. As of 2025, multiple patients have recovered from osteomyelitis with classical homeopathic treatment in our clinic. And right from we can start with the case. And this was a boy diagnosed in 2019 with the post-operative chronic osteomyelitis. So we'll go a little bit fast because number of slides are there. A brief introduction to the conventional management of osteomyelitis. Conventional treatment mainly includes the surgical debridement. Repeatedly, patient was undergoing different type of surgical process to remove the dead bone, to remove the infected and the damaged or the dead tissue from the wound, and antibiotics were given. Success is often limited, relapse is quite common. Moreover, orthopedic interventions such as plating, nailing, or bone grafting can themselves predispose to osteomyelitis. So studies suggest up to 80% of patients undergoing such fixation may develop post-operative bone infections. While surgery restores the structure, it may not prevent recurrence. So, homeopathy, through individualized prescribing, aims to address the susceptibility and chronic inflammation, offering another path of management that can definitely be explored further with my juniors and with my colleagues, present colleagues, and the senior doctors. Now, about the patient information. This patient is a 19-year-old boy. At present, now he is 19 years. And at the time of taking up the case, at the time of diagnosis, he was just 13-year-old. Boy from Tinsukia, Assam, India, who underwent a surgical fixation of his femur bone of the left leg. And the limb reconstruction surgery, that was the nailing and the plating, was not removed on time. This led to the development of infection in the surrounding tissues and then to the bone. On 23rd April 2019, the patient was diagnosed with osteomyelitis in femur bone at Assam Medical College and Hospital, Dibrugarh, Assam. So when we see the report, so-called the pathology, if we'll check the MRI report on 23rd April 2019, the patient was presented with the following things. He was showing the post-operative case of chronic osteomyelitis involving the middle and distal shaft of the left femur with a collection extending up to the knee joint. So if we could not intervene on time, the patient may lose the knee joint. So this was a typical case of worst case of, rather I should say, this was the worst case of osteomyelitis. That's why this case needs some proper light, and that's why I am presenting this case. So at that time when I started this case clinically, this was a video consultation. This was only teleconsultation during the COVID-19. So I took up the case, and case was presenting with the following symptoms: oozing, non-healing wounds, because multiple wounds were there just because of nailing and plating. Nailing means giving screw to the bones, and swelling around the area with the railings and the platings. Severe pain in the left leg, non-responding to the NSAIDs. NSAIDs, non-steroidal anti-inflammatory drugs, and pus discharge from the site of infection with the multiple cloaca or multiple openings. Patient was having recurrent fever up till 101.5 degree Fahrenheit. After unsuccessful treatment in allopathy and fearing amputation, patient's parents consulted us in Chandigarh online. They first approached us on 29th October 2020, and the first batch of medicine was sent to the patient on 9th November 2020. Besides the above sign and symptoms, we did a thorough case taking for this patient, and we found the following type of general symptoms as well as particular symptoms. Now coming to the symptoms presented by the patient. Mental journals. Mental journals, as you know very well, patient was quite disappointed at that time. This was the rubrics. These were the symptoms taken, and further it was converted into the rubrics, as we all do. This is a simple method. I want to tell you about this simplicity of homeopathic medicine. Don't We have not used any type of therapeutic medicine in this. This was a classical case, and we just converted the patient mental state into the rubrics. So he was oversensitive to all external impressions, like slightest noise was disturbing him, slightest type of emotions was he was able to just he was crying and crying and crying. So despair of recovery was there, and leucophlegmatic temperament, like blonde hair, light complexion, and blue eyes. He was a very fair skin. He's a fair skin type of person. And as per my observation, this may be my personal observation, he was a psoric constitution, pale, weak, timid, easily tired, and easily sweating. And disease just arose from the defective assimilation, along with the some uh, problems during the fixation and nailing, as well as the treatment given by conservative system of medicine. So common symptoms, physical generals, common symptoms, skin was cold to touch, as parents told us that his skin is cold to touch, and stool are normal, urine is quite normal, perspiration was very much profuse, and perspiration was during sleep also. And this was very offensive in nature, as patient parents had told me that he's having very offensive type of perspiration. Nobody can enter the room, and he was having very profuse perspiration even after a slightest slightest while going to washroom, while going to pass the motion or toilet. He was having profuse perspiration, and at the same time, patient was very much chilly. He was having lack of vital heat. So sleep, stretching and twisting, perspiration during sleep also, abscess and suppuration. These were the physical generals taken. Injuries, bone fracture off. And now coming to the characteristic particular uncommon symptoms. Thirst for small quantity, for small intervals, thirst for cold water, food and drinks. He always desired eggs. He always desired boiled eggs. He always desired meat. I want to eat meat. I want to eat chicken. I want to eat mutton. So these were the symptoms. And skin, this was cold to touch, as I have already told you. Stool was not too good. Stool was unsatisfactory, and urine was deep yellow. Perspiration profuse, I have already covered this. And the sleep. So as per individualized case taking and classical individualized homeopathy, we adopted the classical homeopathic approach. And after a detailed case analysis, you can see here I have taken just common as well as unusual symptoms that were present at the time of case taking, because this is a case taken through teleconsultation and needs to be corrected on time, right? So I have taken everyone can go through this repertorization chart showing the supplement medicine as calcarea carb. There were no other medicine indicated except silica. So this seems to be a typical case of calcarea carb. And after asking some direct questions or some indirect questions, I concluded about this medicine, calcarea carb. So after a detailed case analysis and repertorization of the patient on 29th October 2020 using the Synergy homeopathic software, the repertorization chart indicated the Simlimum medicine to be calcarea carb. So I am showing you the two repertorial chart here. This is the first one, and this is the continued second one. I have taken total 13 rubrics in this, and calcarea carb was giving me the best of the best score. And I tried to include this reliable repertory as well as FATAG repertory, because he was having a number of symptoms which were pathological in nature. So NUR repertory and FATAG repertory, that is also included in reliable repertory used in Synergy homeopathic software. So we started the treatment with calcarea carb. Monarch score or modified Niranja score is a scoring system and tool in the homeopathic system. It is used to determine how likely it is that a patient's improvement is directly related to homeopathic treatment. It offers a structure and a consistent method for evaluating case reports, thereby enhancing the reliability and evidentiary strength of homeopathy research. So the following is the Monarch score report. This is the complete table of the score. So this was the table of monarch score, and when you will check this table, you can very well identify the direction of cure as well as some other symptoms I have covered, because modified Niranjo criteria is the must for presenting such type of case in some journals of international repute. So this is very, very important for the beginners as well as new joinees and attendees. So we have to follow the international protocol for such type of disease conditions, because without following the international protocols, we cannot say that we have cured the case. So we have to cover the old symptoms. We have to check the alternate causes with the high probability of causing the improvement. So number of things were there, and this modified Niranjo criteria was showing the score of 12. So follow up and the outcomes. I have maintained a pure type of, I should say, this is a pure table of intent of the present symptoms as well as the prescription I have done. So right from 29th October 2020, you can check the condition of the patient. We started the treatment. So after that, 9th November 2020, we started with calcarea carb, and as per the symptoms here given, anyone can go through the case details very clearly. And this was showing calcarea carb as I have shown through the Synergy homeopathic software. And sugar of milk, one dose was given TDS for 30 days. And vitamin D3, here I want to mention here, we have to supplement the patient as per the requirement, because vitamin D as well as calcium in citrate form I have started along with the calcarea carb medicine, right? So let us see the report after this is after 1 month. So unfortunately, patient stopped the medicine due to some financial crisis, and this was the time where COVID-19 was there, and whole word was stuck. So patient was also stuck. He belongs to a very low socioeconomic status, and he was very poor. But he was fortunate enough that he again started the treatment on 26th April 2021 with us, and we right from taking up the case completely, we again find out the medicines to be calcarea carb, and we started with the medicines. So, Mansi, am I audible? Should I continue? Okay. Participants, anyone direct messages? Can anyone tell me, am I audible or not? Because I am not able to.
Yes, yes, sir. You are audible.
Okay, okay, okay. So be with me, and just this is a small case I am going to present, Mansi.
Okay, sir. Okay.
I need your attention also, because this case in some time
Hmm.
patient or attendees, some other attendees may have some questions, so you can just go through this.
Yes, yes, sure, sir.
Right. So this was the case, and as per 26th April 2021 report, till 28th June. So this was the record of 3 months, and patient was again prescribed calcarea carb 200. This is exactly classical homeopathy. What people ask me that why should I prescribe, why should not I disturb the calcarea carb? Because patient was responding very well to calcarea carb. In terms of, you can check the pus, the color of the pus quantity, and pus quality. So this is very, very important while giving any medicine, because this is a highly a tri-miasmatic medicine, calcarea carb, and here we can see the syphilitic nature of the patient. So here calcarea carb was acting as an anti-syphilitic medicine, and pus color right from greenish yellow, it will change to just whitish yellow, and after some time it will change into transparent color. There was no color, transparent discharge was there, and quantity was very less. So I am taking this screen next. Again, 24th of May 2021. Then July, again, no change in the medicine, Calcarea Carb 200 and SOM 1 dose TDS for 30 days. Just simple sugar of milk plus calcium citrate. No visible changes were noticed except the patient was not having fevers. Fixators and plates were not removed. But patient was improving in terms of appetite. So here comes the most important part. Patient was having good appetite. For last 3 years, patient was not able to eat anything, and now he started to eat. So this is the most important parameter while taking the classical homeopathic treatment. And of course, with the now you can see the difference. This is again with the fixator was not removed. This was there. Now coming to 12th September 2021, Calcarea Carb 200 and no visible changes. Fixator and plates were not removed. But overall generalized well-being feeling was there by the patient. So we have not changed the medicine. We just wait. We just wait. You have to wait and watch. You have to wait and watch. Dr. Kent has mentioned very beautifully in uh, his 12 observations. You have to wait. Once the medicine has started working and patient is improving in terms of appetite and the general well-being, we have to wait with the medicine. We have to wait with the medicine. So newcomers, I know some senior doctors are already here. They might be following the Kent 12 observation. If any question is there, we'll take in the last and we'll discuss the Kent 12 observation. As per the Kent 12 observation, we just continued with the Calcarea Carb 200. This may seems quite slow improvement, but this was as per my observation, this was the only case. I have used just SOM 1 dose for 30 days again. Right, coming to next one. Now fixators were removed on 17th Feb 2022. Fixators and plates were removed on 23rd March 2022. Appetite is getting normal. Pus formation is increased and the patient was having mild fever and body pains. So now the fever and pain was decreasing and pus quantity was decreasing. Pus quality was getting viscid and profuse. Again, patient was again still in the syphilitic stage. So this was the photograph when the fixator was removed. Now there was no pus. Patient is feeling better. This is 26th December 2022. Patient is feeling better. Pus discharge continued from the two sinus. Appetite is getting better. Patient generalized well-being was better. Still we are on Calcarea Carb 200. Right. This is the most important point. Again, oozing and non-healing wound from the lateral compartment of the left thigh. Swelling was there. Still patient was having some swellings. But we again wait and watch. And now you can see the difference. After 1 year, this was the major change. We continued the medicine because patient was not having proper money to get the medicines. So the whole village was there to support him. And after that, we were sending medicine to just with teleconsultation, and we were sending the medicines through by post only, by post, by speed post, and we were very much excited about this case because now Niranjan started responding very well. So patient was feeling better in 2023, starting of the 2023 January till April. Patient is feeling better in terms of pus quantity as well as quantity. Now we switch to the higher potency because now the pain is reduced by 70% and appetite has improved. So after giving Calcarea Carb 1M, what I have observed personally, patient was quite better. But here some concerned doctors may say that why have you not changed the medicine potency? Why have you not increased the potency in the initial years? But we stayed with Calcarea Carb 200 for a longer period of time to get the proper nutrition of the bone, because we had to check the nutrition of the bone. We were patient was done a good number of X-rays during the treatment. Just because of he was not able to send it to me because he was not having enough money. So that's why I'm showing you the picture of 2023. So this was the 4th January 2023 photographs. So patient was quite better, and this is the result of Calcarea Carb 1M. But we still continued the treatment, and Calcarea Carb 1M was continued. Patient was better. Patient is feeling better in terms of pus quantity. Now pain is reduced by 80%. Patient developed will to stand up and he tried to walk. This was for the first time. On 26th July 2023, patient started developing the willpower to stand up and he tried to walk, and we just gave the instruction to the parents that he should stand with the help of walker. So started the walking part. Now this is the picture of 30th July 2023. Now we gone higher. This is Calcarea Carb 10M. Again, we waited for more than 4 months with Calcarea Carb 1M, and now patient was improving better. But something were there, pus color was getting light, but getting transparent, but with blood clots. So with if some blood clots are there, uh, Dr. C.B. Nar, he has mentioned in his repertory such type of case, and I referred the case from the Nar repertory, and then went to the case and just studied the case again. And he was having blood clots. That's why I increased the potency to 10 m. And you will be surprised to see the results in the next 2-3 slides, that patient's pain was better, appetite was improved, he was thriving very well. He started gaining weight, and there was a significant reduction in the pus discharge. So overall, patient was improving. This is the picture of 28th October 2023, and we continued with Calcarea Carb 10M. And now you will have to understand the value of anti-psoric medicine. Here I have mentioned the intercurrent remedy as sulfur, because sulfur is the greatest anti-psoric medicine, and we also very well know that pus color was getting better and pus quantity is getting better, but this is not getting totally, it was not disappeared. So pus is already, pus was there, but quantity was less, but it was not curing up. So I intervened with this sulfur 10 m, one single dose. And after that, let us check the results. So this was the, yes, this was the result. And 1st December 2023, patient was better, and after that we prescribed silica for the defective, to cover the defective assimilation of the bones as well as bone marrow. This was my personal observation. I have used many a times silica for defective assimilation, and now the pus color has changed, pus quantity changed, and patient was feeling more optimistic while continuing walking with the support of walker. So this is a typical case of osteomyelitis. Sometimes you will have to wait and watch for the longer period of time, and you will have to bear with the patient. And actually, the patient is suffering, but doctor is also suffering. We'll talk about it later. So Silica 200 again was repeated just to cover the defective assimilation part. And you can see from the table pulsating pain now better by 100%. Swelling of the muscles of the thigh till knee joint reduced by 100%. Pus color light transparent with no blood clots now. And the pus quantity every day just 2 to 4 ml. And pus quality was scanty. Pus was very minimal in nature. But the good point was patient started walking with the help of walker, and cloaca were nearly healed. There were no apertures, there were no openings now. Now the pus discharge has totally stopped, and patient was totally better, getting better again. So this is the photograph for 2024. You need to create a good follow-up. If you want to show such type of cases in some conference or you want to publish in some journal, you will have to create the record. You have to keep the record as well as the photographs of the patient. So these are the photographs. Wound were healing, no pus, no discharge. Patient started walking with the help of walker. And now you can check. This is 18th of April 2024. So right from 2020 to 2024. Before and after photographs are with you. You can very well appreciate the result by classical homeopathy. The patient was reviewed continuously for 12 months till April 2025 without any medical intervention. Medicine was stopped and he found to be completely well. That's why this case is being presented. So sugar of milk supplements were given, vitamin D3 as well as calcium citrate. This following graph shows the percentage improvement. I can show you some graph if anyone wants to see, because I have presented this case in Australian Journal of Homeopathy, and very soon this is going to be published. This is in under processing in Australian Journal of Homeopathy. You can see the graph. Patient's improvement followed a gradual trajectory. Starting 26th April 2021, you can check with this figure, right? So first changes were noted after around 1 year with reduced pain and improved optimism, as assessed during the follow-up of 16th Feb 2022. On 23rd March 2022, nails and plates were removed. After the LRS, limb reconstruction surgery, nails and plates were removed. Pus continued to ooze out from the two sinus. However, the patient's general well-being and appetite was improved. So by June 2023, pus discharge had gradually decreased and the patient developed the willpower to stand up and try to walk. Over the course of the next 8 months, the patient was able to walk with the support and there was significant reduction in the pus discharge. So the latter completely stopped medicines. We have stopped the medicine and around March 2024, and the patient become more comfortable and started walking with the help of walker. Over the next 1 month, patient could walk without support and also started light cycling. Radiological tests were confirmed bone healing by 2023 and the medicines were withdrawn in April 2024. By April 2025, the patient was completely well without any recurrence. So pus discharge, pain and inflammation, and the sinus tract healing. These were the three parameters which were considered while prescribing on the basis of pathology. So these were the all parameters given here: mobility and physical function, bone regeneration and bone health, as well as the most important part, Dr. Henneman used to say, constitutional health, the individualization. Here is the most important part of individualization. Now, no one can expect medicine, calcarea carb or sulfur as an intercurrent medicine in such type of deep pathological cases. But of course, my friends, I am here to give you a hope that you can do wonders with homeopathy. People normally say that homeopathy works very slow. In such cases where no results were there, this is the result with homeopathy. No doubt, if patient is getting slow result, it hardly matters to us. So supplements were also given, and initial aggravation was there. Initially, after giving the medicine, patient noticed some aggravation in the pus discharge. And my friends, you very well know that if such type of aggravation is there, homeopathic aggravation, this is called as homeopathic aggravation in the starting, and that sustained only for a few months. And after that, no homeopathic aggravation was there, or no adverse reactions were reported throughout the treatment duration. So these are the results. Within the first 2 years, pain and pus reduced considerably. By 2023, sinus tracts healed substantially and the patient could walk without support. Weight, appetite, and overall vitality improved. Radiological evidence showed full regeneration of bone with no necrosis. By April 2024, treatment was stopped after complete recovery. As I have told you in the initial slides, this patient was very belonged to very poor socio-economic status. That's why he was not able to do the final test. But still, that is due because we are still following up with the patient, and we have already paid him the amount to get his MRI or CT scan done within this year. And once this is done, we'll submit the case finally, and we'll publish only after the complete documentary evidence. So now the coming to the discussion and conclusion, this case highlights how individualized homeopathy with careful selection of the remedy and miasmatic prescription achieved complete healing. Patient regained the full mobility and systemic well-being. This underscores the importance of integrative care, where classical homeopathy is considered alongside the conventional options, particularly in refractory chronic cases. So these are all other references were there, bibliography is there. Mansi, are you there?
Yes, sir.
So this was the case from my side. Should I stop sharing my screen now and we can take some questions if some questions are there?
Yes, sir. Sure.
I have
So,
mentioned so many things in between because some attendees may be new. They can just download the things and we'll provide the link for this amputation. What is the meaning of proper miasmatic prescription? Right. Thanks and thank you very much, everyone. And you can note down my number. If any queries are there, I'm happy to take on the email. You can just email to me. Thank you. Thank you, Mansi, and thanks everyone.
thank you so much, sir, for this wonderful session. It was a very interesting case, and we happy to see the wonderful results of homeopathy
Yeah.
in such complicated cases. Now it's time for the question and answer. Anyone from the audience, do you have any queries regarding the case? So, sir, we have question from Arvind. He's asking why not calcaria carb 3x or 6x?
We have not started with the 3x or 6x just because such type of tissue salt help in just with the what should I say, normal pathologies. The bones and the bone marrow, we cannot cover with such type of 3x or 6x in calcarea cup because it needs proper deep pathological action. So proper deep pathological action will start only when medicine is more dynamic in nature. So I have started with calcarea cup 200.
Okay, thank you, sir. And so Arvind is again asking, how do you differentiate between calcarea carb 200 and 3x or 6x tissue salts?
No, we cannot differentiate between 3x and medicine should be dynamic in nature.
Hmm.
Dr. Hahnemann has clearly mentioned this. Calcarea Carb 200 was given just on the first day of the month, and that is followed by sugar of milk 3 times a day.
Okay, sir.
You can write me personally, Arvind, if you have more questions because Myristica savifera is having different sphere of action, and for Hippersulf, we cannot cover the deep pathology of bones with Hippersulf, and we can discuss it later on. And you can just write to me personally, not a problem.
Okay, sir. Thank you so much. And next question we have from Anigret. Do you think some doses of calendula around the operation could have prevented the inflammation?
Of course, this is under observation. Still, calendula
Hmm.
is a major medicine that we use in our clinic in some pathological cases as well as in especially injury cases which are lacerated wounds are there. But still, this is to be find out because we cannot comment on such type of sensitive content.
Okay.
Because
Next.
silica during operation, because we
Hmm.
cannot intervene with allopathic system of medicine. Yes, of course, it may help. It might have helped if it was allowed.
Okay. Thank you, sir. Next we have from Kirti. Sir, can you suggest therapeutic book for osteomyelitis?
Not exactly. I am writing a book. This will be a first book of osteomyelitis. I am writing a book. This is under pipeline. This is under processing. So very soon, maybe Bejan publisher will introduce this book.
Thank you, sir. And next, maybe silicia can be given in the first place.
No,
Rabil
silica was
Singh
not
is
at all
asking.
indicated. Actually, silica was not at all indicated. I have shown you the graph initially. As per the Synergy homeopathic software, as well as the individual condition of the patient, calcarea, calcarea carb was the first indicated medicine.
Okay. Okay, I think, sir, we have covered many questions for today, and we have learned so much from you. It's a privilege to learn from you, from your experience, from your clinical insights. I would like to thank again.
Yeah, thank you so
Thank
much
you.
for inviting me on Homeopathic 360 because such type of platforms, these are actually required. And you are giving opportunity to many young homeopaths also. They can create their podcast as well as they can make presentations like this. So this is quite helpful, and this is creating a new milestone in homeopathy, I should say, because in
Thank you.
US there are a number of websites are there who are doing the same things, but you
Yes,
are doing it in a more refined way and in a very good way, I should say. No doubt today's session was a bit delayed. Hope everyone will agree with me because sometimes it happens. Some
yes,
technical
sir.
irregularities are there, but this is normal. But the major, if we'll check Homeopathy 360, I am really inspired. I am really
Thank you
motivated
so
by the
much.
work you people are doing, your team, and I am really thankful to the whole team of Homeopathy 360 and all the attendees. Thank you very much.
Thank you so much, sir, for your wise words. Thanks again, sir. We will meet again, definitely, with another session and another learning.
Of
Thank you so
course.
much, sir.